Introduction. Diabetes is a chronic condition that affects millions of people worldwide. It occurs when the body is unable to properly regulate blood sugar levels, leading to high levels of glucose in the bloodstream. This can have serious consequences, including increased risk of heart disease, blindness, nerve damage, and kidney disease. However, with the right treatment and lifestyle changes, it is possible to manage or even reverse diabetes. In this audiobook, we will explore the various types of diabetes, their causes and risk factors, and the various treatment options available. We will also delve into the role of diet and exercising in managing diabetes, as well as the importance of stress management and overall mental and emotional well being. Through a combination of medical information and practical tips, this audiobook will provide readers with the tools and knowledge they need to take control of their diabetes and live a healthy, fulfilling life. Whether you're living with diabetes yourself or are caring for someone who is, this audiobook is an invaluable resource for anyone looking to better understand and manage this condition. Chapter 1. Understanding Diabetes. Diabetes is a complex and multifaceted condition that requires careful management in order to avoid serious complications. In this chapter, we will explore the different types of diabetes, their causes, and the ways in which they can be treated and managed. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes, also known as insulin dependent diabetes, is an autoimmune condition in which the body immune system attacks and destroys the cell in the pancreas that produce insulin. As a result, people with type 1 diabetes must take daily insulin injections in order to regulate their blood sugar levels. Type 2 diabetes, on the other hand, is a metabolic disorder that occurs when the body becomes resistant to insulin or is unable to produce enough of it. This type of diabetes is often associated with obesity and is much more common than type 1 diabetes. Gestational diabetes, as the name suggests, only occurs during pregnancy and usually goes away after the baby is born. However, women who have had gestational diabetes have a higher risk of developing type 2 diabetes later in life. Regardless of the type, all forms of diabetes involve problems with the regulation of blood sugar levels. High blood sugar or hyperglycemia can lead to a range of serious complications, including heart disease, blindness, nerve damage, and kidney disease. Therefore, it is essential for people with diabetes to carefully manage their condition in order to avoid this complication. In the next chapter, we will delve into the various treatments options available for managing diabetes, including medications, insulin therapy, and lifestyle changes. We will also explore the role of diet and exercise in controlling blood sugar levels and the importance of stress management and overall mental and emotional well being. So, stay tuned. Chapter 2. The Prevalence of Diabetes. Diabetes is a widespread and increasingly prevalent condition that affects millions of people around the world. According to the World Health Organization, WHO, an estimated 422 million people globally were living with diabetes in 2014. And this number is expected to continue to rise in the coming years. In the United States alone, it is estimated that 30.3 million people, or 9.4% of the population, have diabetes. The prevalence of diabetes varies significantly by age, with older individuals being more likely to develop the condition. In the United States, 25.2% of adults aged 65 years or older have diabetes. However, diabetes is not limited to older individuals and is also increasingly being diagnosed in younger people. In the United States, 1.5 million new cases of diabetes are diagnosed each year, and it is estimated that 7.2 million people are living with undiagnosed diabetes. The rising prevalence of diabetes is largely due to the increased rate of obesity and sedentary lifestyle. In the United States, more than two-thirds of adults are overweight or obese, and physically inactive is a major contributor to the development of diabetes. However, other factors such as genetics and certain medications may increase the risk of developing the condition. The high and rising prevalence of diabetes has significant public health implications. In addition to the personal and emotional toll it takes on those affected, diabetes is a major cause of morbidity and mortality and is a leading cause of heart disease, stroke, blindness, kidney disease, and lower limb amputation. The economic impact of diabetes is also significant, with the direct and indirect costs of the disease estimated to be over $327 billion in the United States in 2017. It is clear that addressing the growing prevalence of diabetes is a public health priority. In the next chapter, we will explore the various strategies and interventions that can be used to prevent and manage diabetes, including lifestyle changes, medications, and insulin therapy. Chapter 3: How to diagnose diabetes. If you suspect that you or a loved one might have diabetes, it's important to speak with a healthcare professional and get a proper diagnosis. There are several different ways to diagnose diabetes, and the specific method used will depend on the type of diabetes and the individual symptoms and risk factor. One of the most common ways to diagnose diabetes is through a blood test called a hemoglobin A1C HbA1c test. This test measures the average blood sugar level over the past 2 to 3 months. A normal HbA1c level is below 5.7%, while a level of 6.5% or higher indicates diabetes. However, it's important to note that this test may not be accurate in certain situations, such as during pregnancy or in people with certain blood disorders. Other blood tests that may be used to diagnose diabetes include a fasting plasma glucose (FPG) test, an oral glucose tolerance test, OGTT, and a random plasma glucose RPG test. The FPG test measures blood sugar levels after an overnight fast, while the OGTT measures blood sugar levels after a person consumes a glucose drink. A RPG test can be done at any time and does not require a fast. In addition to blood tests, a healthcare professional may also use other methods to diagnose diabetes, such as a physical examination, a review of the individual's medical history, and an assessment of the person's symptoms. It's important to note that some people with diabetes may not experience any symptoms or may only have mild symptoms that they do not initially attribute to diabetes. Therefore, it is important for all individuals, especially those at high risk for diabetes, to get regularly screened for the condition. Risk factor for diabetes include being overweight or obese, having a family history of diabetes, being physically inactive, and having a history of gestational diabetes. If you have any of these risk factors or are experiencing symptoms such as increased thirst, frequent urination, fatigue, blurred vision, or slow healing of cuts and bruises, it's important to speak with a healthcare professional and get screened for diabetes. Early diagnosis and treatment of diabetes can help prevent serious complications and improve quality of life. Chapter 4: How Diabetes Impacts Your Life. Diabetes is a chronic condition that can have significant impacts on your physical, emotional, and social well being. In this chapter, we will explore the various health complications and other impacts that diabetes can have on your life. One of the most serious health complications associated with diabetes is an increased risk of heart disease. People with diabetes are 2 to 4 times more likely to develop heart disease than those without diabetes, and the risk is even higher for those with poorly controlled blood sugar levels. Diabetes is also a leading cause of stroke, kidney disease, blindness, and nerve damage. In addition to the physical impacts of diabetes, the condition can also have significant emotional and social impacts. Living with diabetes can be challenging and requires a great deal of self management, including regular blood sugar monitoring, taking medication as prescribed, and making lifestyle changes. This can be emotionally and mentally draining and can lead to feeling of frustration, stress, and even depression. Diabetes can also have social impacts as it may limit your ability to participate in certain activities or require changes to your daily routine. For example, you may need to plan your meals carefully, limit your intake of certain foods and drinks, or take medication at specific times. You may also need to adjust your work schedule or make changes to your travel plans to accommodate your diabetes management needs. It's important to recognize and address the potential impact of diabetes on your life and to seek support from your healthcare team and loved ones as needed. With proper management and support, it is possible to effectively manage your diabetes and live a healthy, fulfilling life. Chapter 5: Can diabetes be reversed? One of the most common questions asked by people with diabetes is whether the condition can be reversed or cured. While there is currently no known cure for diabetes, it is possible in some cases to achieve significant improvements in blood sugar control and even achieve remissions of the disease. Several studies have shown that intensive lifestyle interventions, including changes to diet and physical activity, can lead to significant improvements in blood sugar control and even complete reversal of diabetes in some individuals. For example, a study published in the New England Journal of Medicine found that among participants with type 2 diabetes who followed a low calorie diet and increased their physical activity, 46% were able to achieve remission of their diabetes within 1 year. Other studies have also demonstrated the effectiveness of lifestyle intervention in improving blood sugar control and reducing the need for medications in people with type 2 diabetes. In one study, participants who followed a low carbohydrate diet and engaged in regular physical activity were able to significantly improve their blood sugar control and reduce their need for diabetes medications. In addition to lifestyle interventions, some studies have also shown that bariatric surgery, such as gastric bypass, can lead to remissions of diabetes in some individuals. However, it is important to note that these types of procedures are generally reserved for those with severe obesity and should only be considered after careful evaluation by a healthcare professional. While it is clear that diabetes can be effectively managed and in some cases even reversed through intensive lifestyle interventions, it is important to note that these interventions require significant commitment and may not be suitable for everyone. It's important for individuals with diabetes to work closely with their healthcare team to determine the best treatment approach for their individual needs and goals. Chapter 6: Managing Diabetes. Diabetes is a complex and multifaceted condition that requires careful management in order to avoid serious complication. In this chapter, we will explore the various strategies and interventions that can be used to manage and reverse diabetes, including medication, insulin therapy, and lifestyle changes. Medications. For many people with diabetes, medications are an important part of their treatment plan. The type of medication prescribed will depend on the type of diabetes and the individual's specific needs. For people with type 1 diabetes, insulin is a mainstay of treatment. Insulin is a hormone produced by the pancreas that help regulate blood sugar levels. People with type 1 diabetes do not produce enough insulin, so they must take daily insulin injections or use an insulin pump to deliver the hormone. For people with type 2 diabetes, a variety of medications are available to help improve insulin sensitivity and lower blood sugar levels. These medications may be taken orally or injected and may be used alone or in combination with each other. In addition to medication, insulin therapy may also be used to manage diabetes. Insulin therapy involves the use of insulin injections or an insulin pump to deliver the hormones to the body. Insulin therapy is often used in combination with other diabetes medications and may be recommended for those with type 1 or type 2 diabetes who are unable to achieve good blood sugar control with other treatments. Lifestyle changes. In addition to medication, lifestyle changes are an important part of managing and reversing diabetes. These changes may include adopting a healthy diet, increasing physical activity, quitting smoking, and practicing stress management techniques. A diet that is rich in whole, unprocessed foods such as vegetables, fruits, whole grain, and lean proteins can help improve blood sugar control and reduce the risk of complications. Regular physical activity can also help improve insulin sensitivity and lower blood sugar levels. Quitting smoking is also important for people with diabetes, as smoking can worsen blood sugar control and increase the risk of complications. Stress management technique such as relaxation techniques, exercise, or therapy can also help improve blood sugar control and overall well being. It's important to note that while these interventions can be effective in managing and reversing diabetes, they require significant commitment and may not be suitable for everyone. It's important to work closely with a healthcare professional to determine the best approach for your individual needs and goals. Chapter 7: Medication for Diabetes. Medications are an important part of the treatment plan for many people with diabetes. The type of medication prescribed will depend on the type of diabetes and the individual's specific needs. In this chapter, we will explore the various medications that are available for managing diabetes. For people with type 1 diabetes, insulin is the mainstay of treatment. Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels. People with type 1 diabetes do not produce enough insulin, so they must take daily insulin injections or use an insulin pump to deliver the hormone. There are several different types of insulin available, including rapid acting, short acting, intermediate acting, and long acting. The specific type of insulin prescribed will depend on the individual's needs and goals and may be used alone or in combination with other types of insulin. For people with type 2 diabetes, a variety of medications are available to help improve insulin sensitivity and lower blood sugar levels. These medications may be taken orally or injected and may be used alone or in combination with each other. Oral medications for type 2 diabetes include sulfonylureas. These medications stimulate the pancreas to produce more insulin. Meglitinides. These medications work on stimulating the pancreas to produce more insulin in a similar way to sulfonylureas. Thiazolidinediones. These medications work by improving insulin sensitivity. DPP-4 inhibitors. These medications work by blocking an enzyme that breaks down a hormone called GLP-1, which helps regulate blood sugar levels. SGLT2 inhibitors. These medications work by blocking the reabsorption of glucose in the kidneys, allowing excess glucose to be excreted in the urine. GLP-1 receptor agonists. These medications mimic the action of GLP-1, a hormone that helps regulate blood sugar levels. Injectable medications for type 2 diabetes include insulin. As mentioned above, insulin can be used in combination with other medications to help improve blood sugar control in people with type 2 diabetes. Amylin agonists. These medications work by slowing the rate at which food leaves the stomach, helping to control blood sugar levels after meals. GLP-1 receptor agonists. As mentioned above, these medications mimic the action of GLP-1, a hormone that helps regulate blood sugar levels. It is important to note that while medications can be an effective tool for managing diabetes, they are not a substitute for lifestyle changes such as diet and exercise. It's important to work closely with a healthcare professional to determine the best treatment approach for your individual needs and goals. Chapter 8: Safe and Natural Ways to Reverse Diabetes. While there is currently no known cure for diabetes, it is possible in some cases to achieve significant improvements in blood sugar control and even achieve remission of the disease through lifestyle interventions. In this chapter, we will explore some safe and natural ways to reverse diabetes. One of the most effective ways to reverse diabetes is through changes to diet and physical activity. A diet that is rich in whole, unprocessed foods such as vegetables, fruits, whole grain, and lean proteins can help improve blood sugar control and reduce the risk of complications. Additionally, regular physical activity can help improve insulin sensitivity and lower blood sugar levels. Some specific dietary and lifestyle changes that may be helpful in reversing diabetes include adopting a low carbohydrate diet. A diet low in refined carbohydrates and high in healthy fats and protein can help improve blood sugar control and reduce the needs for diabetes medication. Engaging in regular physical activity. Aim for at least 150 minutes of moderate intensity physical activity per week, or 75 minutes of vigorous intensity activity. Practicing stress management techniques. Chronic stress can raise blood sugar levels, so it is important to find ways to manage stress, such as through relaxation techniques, exercise, or therapy. Getting enough sleep. Poor sleep quality and insufficient sleep can worsen blood sugar control. So, it is important to prioritize getting enough restful sleep. Limiting or avoiding alcohol. Alcohol can raise blood sugar levels, so it is important to limit consumption or avoid it altogether. It's important to note that while these lifestyle changes may be effective in improving blood sugar control and reversing diabetes, they require significant commitment and may not be suitable for everyone. It is important to work closely with a healthcare professional to determine the best approach for your individual needs and goals. Additionally, it is important to consult with a healthcare professional before making any significant changes to your diet or exercise routine. Chapter 9: Comparing Medical and Natural Approaches to Diabetes Management. When it comes to managing diabetes, There are a range of options available, including medical interventions such as medications and insulin therapy, as well as natural approaches such as lifestyle changes. In this chapter, we will compare the advantages and disadvantages of both medical and natural approaches to diabetes management. Medical approaches. Medical approaches to diabetes management, such as medication and insulin therapy, can be very effective at controlling blood sugar levels and reducing the risk of complications. These interventions can be especially useful for those with severe or uncontrolled diabetes, or for those who are unable to achieve good blood sugar control through lifestyle changes alone. One advantage of medical approaches is that they offer a more structured and immediate way to manage blood sugar levels. For example, insulin injections can be precisely dosed to meet the individual's needs, and oral medication can be taken at specific time to help control blood sugar levels. However, medical approaches also have some disadvantages. For example, medications can have side effects, and insulin therapy requires injections or the use of an insulin pump. Additionally, medical approaches do not address the underlying causes of diabetes and may not be suitable for everyone. Natural approaches. Natural approaches to diabetes management, such as lifestyle changes, can be very effective at improving blood sugar control and reducing the risk of complications. These approaches address the underlying causes of diabetes, such as poor diet and physical inactivity, and can be tailored to the individual's needs and goals. One advantage of natural approaches is that they are generally safe and have few, if any, side effects. Additionally, lifestyle changes can have a range of other health benefits, such as weight loss, improve cardiovascular health, and reduce stress. However, natural approaches do require significant commitment and may not be suitable for everyone. They may also take longer to achieve results. Chapter 10: A diabetes friendly diet plus recipes. A healthy diet is an important part of managing and reversing diabetes, as it can help improve blood sugar control and reduce the risk of complications. In this chapter, we will explore the principles of the diabetes friendly diet and provide some recipe ideas to get you started. Principles of a diabetes friendly diet. A diabetes friendly diet is one that is rich in whole, unprocessed foods such as vegetables, fruits, whole grain, and lean proteins. It's important to focus on nutrient dense foods rather than those that are high in added sugars, unhealthy fats, and refined carbohydrates. Here are some tips for following a diabetes friendly diet. Choose a variety of fruits and vegetables. Aim for at least 5 servings of fruits and vegetables per day and choose a wide variety to get a variety of nutrients. Opt for whole grains. Choose whole grain breads, cereals, and pastas over refined grains, which are more quickly converted to sugar in the body. Limit unhealthy fats. Choose healthy fats such as olive oil and avocado over saturated and trans fats, which can raise cholesterol levels and increase the risk of heart disease. Choose lean proteins. Opt for lean proteins such as chicken, fish, tofu, and beans over high fats option like red meat. Watch your portion size. It's important to control portion sizes, especially of high calorie and high carbohydrate foods, to avoid overeating and maintain healthy blood sugars levels. A healthy diet is an important part of managing and reversing diabetes as it can help improve blood sugar control and reduce the risk of complication. In this chapter, we will provide some delicious and easy to follow recipe ideas that are suitable for a diabetes friendly diet. Breakfast: avocado toast with eggs. Toast a slice of whole grain bread, mash half an avocado on top, and top with a fried or poached egg. Overnight oats: mix together half cup old fashioned oats, half cup unsweetened almond milk, half cup chopped berries, 1 teaspoon chia seeds, and 1 tablespoon almond butter. Refrigerate overnight and top with additional berries and a sprinkle of chopped nuts in the morning. Egg muffins: preheat your oven to 350 degrees Fahrenheit or 180 degrees centigrade. Beat together 6 eggs, half cup chopped vegetables such as bell peppers, onions, and spinach, and half cup diced cooked protein such as chicken or turkey. Divide the mixture evenly among a muffin tin lined with muffin cups and bake for 20 to 25 minutes or until the muffins are set. Smoothie bowl: combine 1 cup unsweetened almond milk, half cup frozen berries, half banana, quarter cup rolled oats, and 1 scoop protein powder in a blender. Blend until smooth and top with a sprinkle of nuts and seeds. Greek yogurt parfait: layer half cup plain Greek yogurt, quarter cup granola, and half cup fresh fruit in a jar or bowl. Repeat the layers and top with a sprinkle of nuts or seeds. Lunch: quinoa and black bean salad. Mix together 1 cup cooked quinoa, 1 cup black beans, 1 cup diced tomatoes, half cup diced red bell pepper, quarter cup diced red onion, quarter cup chopped cilantro, and 1 tablespoon olive oil. Season with salt and pepper to taste. Grilled chicken and vegetable skewers: thread chunks of chicken breast and a variety of vegetables such as bell peppers, onions, and zucchini onto skewers. Grill until the chicken is cooked through and the vegetables are tender. Egg and vegetable wrap: heat 1 teaspoon of vegetable oil in a frying pan over medium heat. Beat together 2 eggs and quarter cup of diced vegetables such as bell peppers and onions. Pour the mixture into the pan and scramble until the eggs are cooked to your desired levels of doneness. Wrap the eggs and vegetables in a whole grain tortilla or lettuce wrap. Grilled chicken and salad. Grill 4 ounces of chicken breast until it is cooked through. Serve the chicken over a bed of mixed greens along with a variety of vegetables such as cherry tomatoes, cucumber, and bell peppers. Dress the salad with olive oil and vinegar or your choice of diabetes friendly dressing. Black bean and avocado salad. Combine 1 cup cooked black beans, 1 diced avocado, half cup diced tomatoes, and quarter cup diced red onion in a bowl. Toss with the dressing made of 1 tablespoon olive oil, 1 tablespoon lemon juice, and your choice of herbs and spices. Serve over mixed greens or on top of whole grain toast. Tuna and cracker plate. Combine 4 ounces of drained tuna, quarter cup diced celery, and 2 tablespoon diced red onion in a bowl. Mix with 1 tablespoon mayonnaise and 1 teaspoon Dijon mustard. Serve the tuna mixture over whole grain crackers or on top of whole grain bread. Dinner. Baked salmon with roasted vegetables. Season salmon fillets with lemon juice, garlic, and your choice of herbs, and bake until cooked through. Serve with roasted vegetables such as broccoli, Brussels sprouts, and sweet potatoes. Grilled chicken and vegetable skewers. Preheat your grill to medium high heat. Thread bite sized pieces of chicken breast and a variety of vegetables such as bell pepper, onions, and zucchini onto skewers. Grill for 8 to 10 minutes or until the chicken is cooked through and the vegetables are tender. Salmon and quinoa bowl. Cook 1 cup quinoa according to package instructions. Meanwhile, season 4 ounces of salmon fillets with lemon juice, garlic, and your choice of herbs and spices. Grill or bake the salmon until it is cooked to your desired level of doneness. Divide the quinoa and salmon among bowls and top with a mix of roasted vegetables such as Brussels sprouts, sweet potatoes, and bell peppers. Stir fry with tofu and vegetables. Heat 1 tablespoon of vegetable oil in a wok or large frying pan over high heat. Add 8 ounces of cubed tofu and stir fry for 2 to 3 minutes or until it is golden brown. Add a mixture of sliced vegetables such as bell peppers, onions, and broccoli and stir fry for an additional 3 to 4 minutes or until the vegetables are tender. Stir in your choice of sauce such as soy sauce or hoisin sauce and serve over rice or noodles. Grilled portobello mushroom burgers. Preheat your grill to medium high heat. Brush 4 portobello mushroom caps with olive oil. and grill for 4 to 5 minutes per side or until they are tender. Top the mushrooms with grilled vegetables such as bell peppers and onions and your choice of condiments. Serve on whole grain buns or lettuce wrap. Here are some snack ideas for those with diabetes. Apple slice with peanut butter, hard boiled eggs, hummus with vegetables, Greek yogurt with berries, nuts and seeds, edamame, cottage cheese with fruit, turkey and cheese roll ups, deviled eggs, air popped popcorn. Chapter 11: Exercises that are diabetes friendly. Exercise is an important part of managing and reversing diabetes. Physical activity can help lower blood sugar levels, improve insulin sensitivity, and reduce the risk of complication from diabetes. Here are some exercises and physical activities that are particularly good for managing and reversing diabetes. 1. Aerobic exercises. Aerobic exercises such as brisk walking, jogging, cycling, or swimming can help improve insulin sensitivity and lower blood sugar levels. Aim for at least 150 minutes of moderate intensity aerobic exercise per week. 2. Resistance exercises. Resistance exercises such as weightlifting and body weight exercises can also help improve insulin sensitivity and lower blood sugar levels. Aim for at least 2 days of resistance exercise per week. 3. Flexibility exercises. Stretching and flexibility exercises such as yoga and Pilates can help improve balance, flexibility, and overall physical function. Incorporating flexibility exercise into your routine can also help reduce the risk of falls and injuries. 4. High intensity interval training, HIIT. HIIT is a type of exercise that involves short bursts of high intensity activity followed by periods of rest. HIIT has been shown to be particularly effective at improving insulin sensitivity and blood sugar control in people with diabetes. 5. Other activities. In addition to structured exercise, it's also important to incorporate physical activity into your daily routine. This can include activities such as gardening, housework, or taking the stairs instead of the elevator. It's important to talk to your healthcare provider before starting any new exercise program. They can help you develop a safe and effective exercise plan that is tailored to your specific needs. Conclusion: Diabetes is a chronic disease that affects millions of people around the world. While there is no cure for diabetes, it is possible to effectively manage and even reverse the condition through lifestyle changes. These changes include eating a healthy diet, getting regular physical activity, and maintaining a healthy weight. By implementing these changes, people with diabetes can improve their blood sugar control, reduce their risk of complications, and improve their overall quality of life. It's important to work with a healthcare team to develop a personalized plan that meets your specific needs. Managing and reversing diabetes requires dedication and commitment, but the effort is well worth it. By taking control of your health and making lifestyle changes, you can live a happier, healthier life. Remember that small changes can make a big difference and that you are not alone on your journey to better health. This has been Reverse Diabetes Forever, the whole body plan to stop diabetes. Learn useful tips on how to reverse diabetes. Written by Julie Ann Barrett, read by Shafi. This is Control Your Blood Pressure, the ultimate guide to lowering blood pressure naturally. Written by Dale Breyer, read by Shafi. Introduction. High blood pressure, also known as hypertension, is a silent killer that affects millions of people worldwide. Left untreated, it can lead to serious health complications such as heart attack, stroke, and kidney disease. However, the good news is that high blood pressure is a preventable and treatable condition. In this audiobook, we will explore the various causes of high blood pressure and provide practical and effective strategies for lowering it, from lifestyle changes such as diet and exercise to medication and natural remedies. You will learn how to take control of your blood pressure and improve your overall health. You will learn about the DASH diet, which has been shown to be effective in lowering blood pressure, as well as the benefit of regular exercise and stress management. We will also discuss the various medication used to treat hypertension, including their potential side effects and how to use them safely. Additionally, we will explore the use of natural remedies and supplements such as omega 3 fatty acids, magnesium, and CoQ10 as complementary treatments for high blood pressure. Take control of your health and lower your blood pressure today. Listen to this audiobook and start the journey towards a healthier and longer life. Chapter 1. Understanding Blood Pressure. Blood pressure is a force of blood pushing against the walls of your arteries as it flows through your body. It is measured in millimeters of mercury, mmHg, and is usually written as two numbers such as 120/80 mmHg. The first number, 120, in this example, is called the systolic pressure and it measures the force of blood in your arteries as your heart pumps it out. The second number, 80, in this example, is called the diastolic pressure and it is measure the force of blood in your arteries when your heart is at rest between beats. Normal blood pressure is considered to be around 120/80 mmHg. However, blood pressure can vary depending on factors such as age, sex, and overall health. For example, blood pressure tends to be higher in older adults and men, and it can also be affected by conditions such as obesity, diabetes, and smoking. High blood pressure, also known as hypertension, occurs when the force of blood against the walls of your arteries is consistently too high. High blood pressure can cause damage to your blood vessels and organs, increasing your risk of serious health problems such as heart attack, stroke, and kidney disease. Low blood pressure, also known as hypotension, occurs when the force of blood against the walls of your arteries is consistently too low. Low blood pressure can cause symptoms such as dizziness, lightheadedness, and fainting. It is important to have regular checkups to monitor your blood pressure, especially if you have risk factors for hypertension, such as family history, age, obesity, or smoking. Blood pressure can be measured in several ways, including manual measurement with a sphygmomanometer, a cuff that is wrapped around the upper arm and inflated to measure the pressure, and automatic measurement with an electronic device. It is important to understand the reading of your blood pressure, as hypertension may have no symptoms but can be identified through regular measurement and monitoring. Understanding your blood pressure is the first step in managing and maintaining a healthy blood pressure and reducing the risk of hypertension related complications. Chapter 2: Causes of High Blood Pressure. High blood pressure, also known as hypertension, is a condition in which the force of blood against the walls of your arteries is consistently too high. This can cause damage to your blood vessels and organs over time, increasing your risk for serious health problems such as heart attack, stroke, and kidney disease. There are several possible causes of high blood pressure, including 1. Primary hypertension. This is the most common form of hypertension and is caused by a combination of genetic and lifestyle factors. Factors such as obesity, poor diet, lack of exercise, and stress can contribute to the development of primary hypertension. 2. Secondary hypertension. This form of hypertension is caused by an underlying medical condition or the use of certain medications. Common cause of secondary hypertension include kidney disease, sleep apnea, thyroid disorder, and the use of birth control pills. 3. Age. As you get older, your blood vessels naturally become stiffer, which can cause an increase in blood pressure. 4. Gender. Men tend to have higher blood pressure than women, although the risk of hypertension increases for both sexes as they age. 5. Family history. If you have a family history of hypertension, you may be at higher risk for developing the condition. 6. Lifestyle factors. A diet high in salt, being overweight or obese, lack of physical activity, smoking, excessive alcohol consumption, and stress are lifestyle factors that are linked to hypertension. It is important to note that hypertension can have no symptom, and that's why regular checkups and monitor of blood pressure is important. A combination of genetic and environmental factors can lead to hypertension, and it's not always possible to know exactly what causes it. However, by understanding the potential causes and making lifestyle changes, you can take steps to prevent hypertension and lower your risk for serious health problems. Chapter 3: The Scope of Hypertension. Hypertension, or high blood pressure, is a serious health condition that affects millions of people worldwide. In the United States alone, an estimated 78 million adults, or 1 in 3, have high blood pressure, and the majority of these individuals are not aware that they have the condition. The statistics for hypertension in the United States are alarming. According to the Center for Disease Control and Prevention, CDC, about 34.5% of US adults aged 20 and older have hypertension. The American Heart Association, AHA, estimates that about 29% of US adults have hypertension and an additional 31% have pre-hypertension, blood pressure that is higher than normal but not yet in the hypertension range. Hypertension is more common in African Americans, affecting around 44% of all non-Hispanic African Americans adult in the United States. Age is also a major risk factor for hypertension, with the prevalence of hypertension increasing as people get older. Hypertension is not just a problem in the United States, it's a global problem. The World Health Organization, WHO, estimates that hypertension affected around 1.13 billion people worldwide, and this number is expected to increase to 1.56 billion by 2025. Hypertension is a leading risk factor for global deaths, causing around 9.4 million deaths each year. The incidence of hypertension is increasing globally, particularly in low and middle income countries where rates are projected to double by 2025. It's important to note that hypertension is a preventable and treatable condition, but it can have no symptoms, and that's why screening, early detection, and management is crucial. Regular checkups and monitoring of blood pressure is essential for identifying hypertension and taking steps to control it before it leads to serious health problems. The statistics demonstrate the high impact that hypertension has globally and the importance of hypertension awareness, prevention, and control. By understanding the prevalence of hypertension, we can work together to raise awareness and take action to improve the health of millions of people worldwide. Chapter 4: Types of Hypertension. Hypertension or high blood pressure is a serious health condition that affects millions of people worldwide. It is classified into two main types: primary hypertension and secondary hypertension. 1. Primary hypertension. This is the most common form of hypertension and is caused by a combination of genetic and lifestyle factors. Factors such as obesity, poor diet, lack of exercise, and stress can contribute to the development of primary hypertension. It usually develops over time and has no specific underlying cause. 2. Secondary hypertension. This form of hypertension is caused by an underlying medical condition or the use of certain medications. Common causes of secondary hypertension include renal artery stenosis, narrowing of the blood vessels that supply the kidney; renal parenchymal disease, disease of the kidneys themselves; endocrine disorders such as primary aldosteronism, pheochromocytoma, and Cushing's syndrome. Congenital defects of the blood vessels, such as coarctation of the aorta, medications such as birth control pills, cold remedies, and some prescription drugs. Illegal drugs such as cocaine and amphetamines. It is important to note that although primary hypertension is more common, secondary hypertension is more severe and may require more aggressive treatment. That's why it is important to have a proper diagnosis and evaluation to understand the type of hypertension. Another classification that is used to describe hypertension is isolated systolic hypertension, which is when the systolic pressure is higher than 140 mmHg, but the diastolic pressure is less than 90 mmHg. This type of hypertension is more common in older adults and is associated with an increased risk of cardiovascular disease. Managing hypertension requires identifying the type and understanding its underlying causes. A comprehensive approach that includes lifestyle modification, medication, and monitoring is the key for effective hypertension management. Chapter 5: Diagnosis of high blood pressure. High blood pressure or hypertension is a serious health condition that affects millions of people worldwide. However, hypertension can be a silent condition, meaning that it often has no symptoms and can only be diagnosed through regular measurements and monitoring of blood pressure. Diagnosis of hypertension typically involves measuring blood pressure on two or more occasions. Blood pressure is measured in millimeters of mercury mmHg and is usually written as two numbers such as 120/80 mmHg. The first number, 120 in this example, is called the systolic pressure, and it's measure the force of blood in your arteries as your heart pumps it out. The second number, 80, in this example is called the diastolic pressure, and it measures the force of blood in your arteries when your heart is at rest between beats. The American College of Cardiology (ACC) and the American Heart Association (AHA) have established the following criteria for the diagnosis of hypertension. Blood pressure greater than or equal to 130/80 mmHg is considered hypertension. Blood pressure between 120/80 mmHg and 129/79 mmHg is considered pre-hypertension. It is important to note that these measurements should be done in a proper setting, such as a doctor's office or clinic, and in a calm state. It's also recommended to do multiple readings over time, as hypertension is defined as having a consistent high blood pressure over time. When hypertension is diagnosed, further evaluation and tests may be necessary to understand the underlying cause. These tests may include urinalysis to check for protein or blood in the urine, which may indicate kidney damage. Blood test to check for anemia, glucose, cholesterol, and triglyceride levels, which may indicate other underlying medical conditions. Imaging tests such as ultrasound or computed tomography (CT) scan to check for abnormalities in the blood vessels or organs that may be causing hypertension. It is important to note that hypertension is a preventable and treatable condition, but earlier detection and proper management is crucial to reduce the risk of hypertension related complications. Regular checkups and monitoring of blood pressure is essential to identify hypertension and take steps to control it before it leads to serious health problems. Chapter 6: Risk Factors for High Blood Pressure. High blood pressure or hypertension is a serious health condition that affects millions of people worldwide. Understanding who is at risk of developing hypertension is an important step in preventing and managing the condition. There are several risk factors that can increase your likelihood of developing hypertension, including 1. Age. As you get older, your blood vessels naturally become stiffer, which can increase your risk of hypertension. 2. Gender. Men tend to have higher blood pressure than women, although the risk of hypertension increases for both sexes as they age. 3. Family history. If you have a family history of hypertension, you may be at a higher risk for developing the condition. 4. Lifestyle factors. A diet high in salt, being overweight or obese, lack of physical activity, smoking, excessive alcohol consumption, and stress are lifestyle factors that are linked to hypertension. 5. Race and ethnicity. African Americans have a higher risk of hypertension than other racial or ethnic groups and are more likely to have hypertension at a younger age. 6. Chronic health condition. People with diabetes, kidney disease, sleep apnea, and some thyroid disorders have a higher risk of developing hypertension. 7. Medication. Some medication, such as birth control pills, cold remedies, and certain prescription drugs, can increase blood pressure. It's important to note that hypertension can develop without any visible symptoms, and that's why regular checkups and monitoring of blood pressure is important. If you have any risk factors, it's important to be aware of them and to work with your healthcare provider to monitor your blood pressure and take steps to prevent hypertension or manage it if it develops. By understanding your risk factors, you can take steps to prevent hypertension and lower your risk for serious health problems. Lifestyle changes, medication, and monitoring are the key elements of hypertension management. Chapter 7: Symptoms of High Blood Pressure. High blood pressure or hypertension is a serious health condition that affects millions of people worldwide. However, hypertension is often referred to as the silent killer because it often has no visible symptoms. In many cases, hypertension is only discovered during a routine checkup or as a result of a related complication. In some cases, though, hypertension can cause symptoms such as headache, especially at the back of the head, dizziness or lightheadedness, nosebleeds, shortness of breath, chest pain, vision changes, tinnitus, ringing in the ears, fatigue, trouble sleeping. It's important to note that these symptoms can be caused by other conditions and do not necessarily indicate hypertension. It's essential to have your blood pressure checked regularly, even if you're not experiencing any symptoms. Hypertensive crisis is a term used to describe a severe increase in blood pressure that requires immediate medical attention. Symptoms of hypertensive crisis include severe headache, blurred vision, chest pain, difficulty breathing, and severe anxiety. If you experience any of these symptoms, seek medical attention right away. Hypertensive retinopathy, which is damage to the blood vessels in the eyes caused by hypertension, is another serious complication that can occur as a result of long term hypertension. It can cause vision loss, blind spots, and visual distortions. Hypertensive encephalopathy, another serious complication, which is a condition in which high blood pressure causes brain damage. This can cause confusion, seizures, and even coma. It's important to note that hypertension can have no symptoms, and that's why regular checkups and monitoring of blood pressure is important. If you experience any symptoms or suspect that you might have hypertension, it's important to consult with your healthcare provider for proper diagnosis and management. Chapter 8: Medication for High Blood Pressure. High blood pressure or hypertension is a serious health condition that affects millions of people worldwide. Medications are an important aspect of hypertension management, and there are several types of medication that are used to treat hypertension. 1. Diuretics, also known as water pills. These medication work by increasing the amount of salt and water that is eliminated from the body through urine, which in turn reduce the amount of fluid in the blood vessels, lowering blood pressure. 2. ACE inhibitors. These medication block the production of a substance in the body that causes blood vessels to constrict, which reduces blood pressure. 3. Angiotensin receptor blocker ARBs. These medication work by blocking the action of a substance in the body that cause blood vessels to constrict, which reduce blood pressure. 4. Calcium channel blockers. These medications relax the smooth muscle in the walls of the blood vessels, which reduces the resistance to blood flow and lower blood pressure. 5. Beta blockers. These medications reduce the workload on the heart by slowing the heart rate and relaxing the blood vessels, which reduces blood pressure. 6. Aldosterone antagonist. These medication block the action of aldosterone, a hormone that can cause the body to retain sodium and water, which in turn raises blood pressure. It is important to note that different patients may respond differently to different medication, and that is why it is crucial to work with your healthcare provider to find the best treatment for you. Medications may need to be adjusted or changed depending on the patient's blood pressure levels and any side effects. It is also important to note that lifestyle changes such as a healthy diet, regular exercise, and stress management are important in managing hypertension. And in many cases, these measures can reduce the need for medication or can be used in combination with medication. It is important to take your medication as prescribed and to keep all scheduled appointments with your healthcare provider to monitor your blood pressure and adjust your treatment plan as needed. Remember that medication is an important tool for managing hypertension, but it's not a substitute for healthy lifestyle habits. Chapter 9: Natural ways to lower blood pressure. High blood pressure, also known as hypertension, is a serious health condition that affects millions of people around the world. If left untreated, hypertension can lead to a host of other health complications, including heart disease, stroke, and kidney damage. However, the good news is that there are a number of natural ways to lower blood pressure and reduce your risk of these serious conditions. One of the most effective natural way to lower blood pressure is through lifestyle changes. This include eating a healthy diet that is low in salt, fat, and processed foods, and high in fruits, vegetables, and whole grains. Additionally, regular physical activity such as walking, cycling, or swimming can help to lower blood pressure and improve overall cardiovascular health. Another important aspect of managing hypertension is managing stress. Stress can cause a temporary increase in blood pressure, and chronic stress can contribute to the development of hypertension. It's important to find the ways to manage stress through techniques such as deep breathing, meditation, or yoga, or talking to a therapist. Other natural ways to lower blood pressure include quitting smoking, limiting alcohol intake, and getting enough sleep. Nicotine and alcohol both constrict blood vessels, which can raise blood pressure. Additionally, lack of sleep can contribute to an increase in blood pressure. By quitting smoking, limiting alcohol, and getting enough sleep, you can reduce your risk of hypertension and lower your blood pressure. Supplements can also be helpful in managing hypertension. Some studies suggest that supplements like fish oil, magnesium, potassium, and CoQ10 can help to lower blood pressure. However, it is important to talk to a healthcare professional before starting any new supplement regimen, as some supplements can interact with medication or have other negative side effects. In summary, high blood pressure is a serious condition that affects millions of people, but there are natural ways to lower blood pressure and reduce your risk of serious health complications by making lifestyle changes such as eating a healthy diet, getting regular exercise, managing stress, quitting smoking, limiting alcohol, getting enough sleep, and considering some supplement. You can take control of your blood pressure and improve your overall health. Note: this is a general overview of the topic. Always consult a healthcare professional before making any changes to diet or exercise routine and before starting on any supplements. Chapter 10: Lifestyle changes to lower blood pressure. High blood pressure, also known as hypertension, is a common health condition that affects millions of people worldwide. It is known as a silent killer because it often has no symptoms, but it can lead to serious health complications such as heart disease, stroke, and kidney damage. Fortunately, hypertension can be managed through lifestyle changes that can help lower blood pressure and reduce the risk of this complication. One of the most important lifestyle changes that can help lower blood pressure is eating a healthy diet. A diet that is low in salt, fat, and processed foods, and high in fruits, vegetable, and whole grain can help to reduce hypertension. The DASH diet, dietary approaches to stop hypertension, is an example of a diet that is specifically designed to lower blood pressure. It emphasizes foods that are high in potassium, magnesium, calcium, and protein, and low in saturated and total fat. Another important lifestyle change is getting regular physical activity. Regular physical activity can help to lower blood pressure by improving the overall health of the cardiovascular system. Aim for at least 30 minutes of moderate intensity physical activity, such as brisk walking, cycling, or swimming on most days of the week. Weight management is also important in managing hypertension. Being overweight or obese can increase your risk of developing hypertension, and losing weight can help to lower blood pressure. Aim for a healthy weight through regular exercise and a balanced diet. Managing stress is another important lifestyle change that can help to lower blood pressure. Stress can cause a temporary increase in blood pressure, and chronic stress can contribute to the development of hypertension. Techniques such as deep breathing, meditation, yoga, or talking to a therapist can help to reduce stress. Quitting smoking is another important lifestyle change that can help to lower blood pressure. Nicotine and other chemicals in cigarettes constrict blood vessels, which can raise blood pressure. Additionally, quitting smoking can also help to reduce your risk of developing other health problems such as heart disease and cancer. Limiting alcohol intake is also an important lifestyle change that can help to lower blood pressure. Excessive alcohol consumption can raise blood pressure and contribute to the development of hypertension. Aim to limit your alcohol intake to no more than 2 drinks per day for men and 1 drink per day for women. Getting enough sleep is also important in managing hypertension. Lack of sleep can contribute to an increase in blood pressure. Aim for 7 to 8 hours of quality sleep per night. In summary, lifestyle changes such as eating a healthy diet, getting regular physical activity, managing stress, quitting smoking, limiting alcohol, getting enough sleep, and maintaining a healthy weight are all effective ways to help lower blood pressure and reduce the risk of serious health complication. It is important to consult a healthcare professional before starting any new diet or exercise regimen, or before making any other lifestyle changes. Note: this is a general overview of the topic. Always consult a healthcare professional before making any changes to diet or exercise routine. Chapter 11: Exercise and Hypertension. Hypertension or high blood pressure is a common health condition that affects millions of people worldwide. It is a major risk factor for heart disease and stroke, and if left untreated, can lead to serious health complications. However, lifestyle changes, including regular physical activity, can help lower blood pressure and reduce the risk of hypertension related complications. Aerobic exercise is one of the most effective type of physical activity for people with hypertension. Aerobic exercise, also known as cardio, is any activity that increases the heart rate and breathing for an extended period of time. Examples of aerobic exercise include walking, cycling, swimming, and dancing. These type of exercise can help lower blood pressure by improving cardiovascular fitness, reducing inflammation, and promoting weight loss. Resistance exercise, also known as strength training, is another important type of physical activity for people with hypertension. Resistance exercise includes weightlifting, resistant bands, and body weight exercise that help to strengthen muscles and improve bone density. Resistance training has been shown to help lower blood pressure by increasing muscle mass and improving insulin sensitivity. Yoga and Tai Chi are also beneficial for people with hypertension. These practices focus on breathing and relaxation techniques which can help lower stress and blood pressure. Yoga and Tai Chi can also improve flexibility and balance, which can help prevent falls in older adults. High intensity interval training, HIIT, is a type of cardio that alternates short periods of intense activity with longer period of recovery. HIIT has been shown to be effective in reducing blood pressure and improving cardiovascular health. It is important to consult with your doctor before starting any new exercise program, especially if you have hypertension or other health conditions. A doctor can help you create an individualized exercise plan that is safe and effective for you. It is also important to note that regardless of the type of exercise, it is important to start slowly and gradually increase the intensity and duration of the exercise. It's also important to stay hydrated, listen to your body, and not overdo it. Regular physical activity is an important part of managing hypertension. By incorporating aerobic, resistance, yoga, and Tai Chi, HIIT, exercise into your daily routine, you can lower your blood pressure, improve your overall health, and reduce your risk of hypertension related complications. Chapter 12: Delicious recipes for lowering blood pressure. Eating a healthy diet that is low in salt, fat, and processed foods, and high in fruit, vegetables, and whole grain is one of the most effective ways to lower blood pressure and improve cardiovascular health. This chapter will provide a few sample recipes that are delicious, nutritious, and perfect for managing hypertension. 1. Grilled salmon with mango salsa. This flavorful and easy to make recipe is packed with heart healthy omega 3 fatty acids and potassium. Ingredients: 4 salmon fillets, salt and pepper to taste, 1 ripe mango, peeled and diced, 1 small red onion, diced, 1 red bell pepper, diced, 2 tablespoons fresh lime juice, 2 tablespoons fresh cilantro chopped. Directions: 1. Preheat a grill to medium high heat. 2. Season salmon fillets with salt and pepper. 3. Grill the salmon for 4 to 5 minutes per side or until cooked through. 4. Meanwhile, in a medium bowl, combine the diced mango, red onion, red bell pepper, lime juice, and cilantro. 5. Serve the salmon with the mango salsa on top. 6. Quinoa and black bean salad. This tasty and filling salad is high in protein and fiber, which can help to lower blood pressure. Ingredient: 1 cup quinoa, 2 cups water, 1 can black beans drained and rinsed, 1 red bell pepper diced, 1 small red onion diced, 1 jalapeno pepper seeded and diced, 1/4 cup fresh cilantro chopped, 2 tablespoons olive oil, 2 tablespoons fresh lime juice, salt and pepper to taste. Directions: 1. Rinse the quinoa in a fine mesh strainer. 2. In a medium saucepan, bring the water to a boil and add the quinoa. 3. Reduce heat to low. Cover and simmer for 18 to 20 minutes or until the water is absorbed. 4. Fluff the quinoa with a fork and let it cool. 5. In a large bowl, combine the cooled quinoa, black beans, red bell pepper, red onion, jalapeno pepper, and cilantro. 6. In a small bowl, whisk together the olive oil and lime juice and pour it over the quinoa mixture. 7. Toss the salad to combine and season with salt and pepper to taste. 8. Roasted eggplant and tomatoes. This simple and delicious recipe is high in potassium and magnesium, which can help to lower blood pressure. Ingredients: 1 large eggplant sliced, 1 pinned cherry tomatoes, 2 tablespoons olive oil, salt and pepper to taste, 1/4 cup fresh basil chopped. Directions: 1. Preheat the oven to 400 degrees Fahrenheit. 2. In a large bowl, toss the eggplant and cherry tomatoes with olive oil, salt, and pepper. 3. Spread the eggplant and tomatoes out on a baking sheet. 4. Roast for 25 to 30 minutes or until the vegetables are tender and lightly browned. 5. Remove from oven and sprinkle with fresh basil. In summary, these recipes are simple, delicious, and most importantly, nutritious that can help lower blood pressure and improve cardiovascular health by providing key nutrients such as potassium, magnesium, fiber, and omega 3s. It's important to remember that a healthy diet is just one aspect of managing hypertension and these recipes. Conclusion. High blood pressure or hypertension is a serious health condition that affects millions of people worldwide. Left untreated, it can lead to serious health complications such as heart disease, stroke, and kidney damage. However, the good news is that hypertension can be managed through a combination of lifestyle changes, medication, and natural remedies. Lifestyle changes such as eating a healthy diet, getting regular physical activity, managing stress, quitting smoking, limiting alcohol, getting enough sleep, and maintaining a healthy weight are all effective ways to help lower blood pressure and reduce the risk of serious health complications. Additionally, natural supplements such as fish oil, magnesium, potassium, and CoQ10 can also be helpful in managing hypertension. It's important to consult with a healthcare professional before making any changes to your diet or exercise routine or starting any new supplement regimen. In combination with medication, if needed, and following the guidance of a healthcare professional, lifestyle changes can be a powerful tool in managing hypertension and improving overall health. In this audiobook, we have covered various topics such as the causes, risks, and consequences of hypertension, the various ways of diagnose and monitor blood pressure, and most importantly, different methods of managing hypertension through lifestyle changes, natural remedies, and medication. We hope that this audiobook has provided valuable information and inspiration for anyone looking to lower their blood pressure and improve their overall health.